Hey, what's up, everybody? Today I am here with this very special guest, Dr. Cole. Dr. Cole is a surgical intern in Louisiana. He is specializing in orthopedic surgery, and he's also the author of, you know what? I've got it here somewhere. The
Oh,
Med
and you have
School,
the
the
book with
Med
you.
School Survival Kit.
Oh,
This guy
yeah.
wrote this book. I read it. It's a hell of a read. For anyone, struggling to get through medical school, worried about intern year. What we're going to be talking about today is Dr. Cole's experience with intern year. And basically, is it what he expected? Is it what you expect? What to expect? What you should know going into it? So on and
Yep.
so forth. With that being said, I'm going to kick it on over to Dr. Cole. Dr. Cole, tell the audience a little bit about yourself.
Yeah, guys. So thanks for that introduction. I really appreciate it. So like you said, I'm an orthopedic surgery intern out here in New Orleans, Louisiana. I went to med school in Atlanta, Georgia at Morehouse School of Medicine. I wrote the book, The Med School Survival Kit. I also have a podcast myself called Convos with Cole. And I'm coming out with another orthopedic podcast called Nailed It Soon. So be on the lookout for that, guys.
I like that name. Nailed it soon.
Oh, yeah.
That's great.
No, just nailed it. This is called Nailed It, but it's coming out
Nailed it.
soon. Yep.
Very, very ortho humor. I love it.
Oh, yeah.
All right. So today, let's just jump right into it. We're going to talk about
Let's do
intern
it.
year. You're about 6 months in now. Is that right?
I am. We just crossed the halfway mark. It's
Yeah,
going
nothing
quick.
scares me more than going into my first day of intern year. Everything changes. You're responsible for people. I have no idea what I should know, what I should be doing right now to prepare for intern year. So tell me, what was your first day like? What should us fourth year medical students expect on their first day of intern year?
Well, I think it depends on the specialty that you go into, right? But for me, my first day, I was right in the OR, right in the operating room my first day. And kind of the thing is when you're going into it, it's all the other things that you wouldn't expect. Like, the medicine, but it's like how to do orders. Then, it's kind of managing the patient. And then now you have the responsibility of you actually have your own patients that you're taking care of. So it's more just a learning curve of trying to figure out how to put in the orders. Oh, am I doing 5 milligrams or 10 milligrams every
Yeah.
6 hours, every 8 hours? It's like those little small, minute details, which after a while you kind of get used to.
Yeah, but that's scary. I mean, what do they expect you to know? They don't expect you to know, like, come in and here's the dosage I know that this person should get. Here's how I put in the order for that dosage. I mean,
No,
the wrong order could kill somebody. Like, how much support
yeah,
is there?
yeah. I mean, in my program, there's plenty of support, so everybody knows that that you're an intern and that it's your first day.
Yeah.
So everybody's kind of looking at you to make sure not saying that make sure that you don't mess up, but make sure that you kind of have the right guidance and you know what you're doing. Show somebody how to do something a couple times, and after that, you should be able to do it on your own. So I think just having a good program and having a good support system and having good upper levels takes you a long way. They show you the ropes because they know where it's at. They know what it's like. Sometimes if you're cheap, you might forget what it's like. But, the second, third years, they know exactly what it's like to be a first day as an intern.
Yeah. So that you have good support your first year. You're not thrown into the wolves like, all right, this patient is now your responsibility. You're in charge of putting the right orders, ordering the right tests, knowing what to order at all times. And like you have upper levels to look to ask questions at all times.
Right. Well, it's a mix between the two. It's like a fine line. You have like an area where you have to figure out. You just don't want to, like, you may not want to hit them up and like send them, like, trying to reach out to them because you want to figure it out on your own. But you know that they're there if you need it. You don't want to be like a pest, but you also not trying to like mess up medications or anything. So it's a fine line, but you can balance on that line pretty easily.
Definitely. Okay. So your level of responsibility, what would you say? Have you ever felt like you were fully responsible for a patient, maybe during an overnight shift when you wasn't so much support? Was that scary?
Well, again, they all know we're interns, so
Yeah.
even in overnight, we have at least an upper level to call. There's been some times where patients I thought had a pulmonary embolism, or different things that for that patient turned out she actually did, or that person actually did have a PE. But you always have an upper level to call and run things by. The one thing you don't want to do is not tell anybody and think you can handle it on your own, because that's when you get in trouble. Because then you
Yeah.
don't know exactly what to do, and then you take control of it, and you don't tell your second year, you don't tell your chief, and then it's like, well, it all kind of falls on you.
So on the other hand of that, about not getting too much responsibility, do you have enough power? Say you think that patient has a pulmonary embolism, or at least need to rule it out. can you be like, I need a CTA on this patient without consulting any of your upper levels?
Yeah, so in that case, I ordered the CT and then I called, the upper level, like, hey, this is what we have going on. This is their symptoms. I think they're having a pulmonary embolism. I already put in for a CT scan. Is there anything else that you want me to do? Kind of, so you want to be proactive at the same time, but like, hey, is there anything else that I'm missing that you would kind of want me to do, or, something that I might be missing, so again, it's that thin line of being proactive or not being proactive and be like, I took care of the whole thing myself. And then you find out that you missed 3 or 4 of the
Yeah.
things that could have been, avoided.
It's a scary time, man. Scary time.
Oh yeah. But I mean, it's not that bad. It's not too bad.
Yeah. That what you said is comforting, that you have so much support and you never really felt like, you were going to kill somebody and it's all on you if something goes wrong, that, you've always got someone to kind of hold your hand that first year. And as juvenile as that sounds, but you need it. I mean, if you were to say right now to me, like, you're in charge of this patient's life, like, good luck, I'd poop my pants on the spot.
But in many cases, you are the first person, that they call, because you'll be holding, or at least for us, like, we'll be holding the pager. So if there's anything that goes on, you have to be there. You are the first line of like defense. They will call you first with what's going on. So you also have to be competent enough to be able to recognize when things are not the way it's supposed to be and when you do need help.
Definitely. So tell me about the other aspects of intern year. You still have a social life?
Yeah, man. So I make it a priority to always have some type of a social life. Now, don't get me wrong. There are weeks where you're just working nonstop, but there are other times where some rotations may be a little bit chiller than others, where you'll have a little bit of time. I found out I found it weird that with each step further along I take, I feel like I do more things socially. So now I feel like I've done more things or been more places in residency than I have in medical school. And, it's just kind of crazy because, at least for me, I force myself to go out and do things. I know if you don't force yourself to have a balance, then it kind of can just eat at you and, you'll just be stuck in this wormhole.
I believe that with every ounce of me. You need to make an effort to have that social life. It's easy to stay in and study or stay in and sleep, watch TV, but that's not going to benefit you. You need to find that balance, go to the park, go outside, do those things. And it can be tough, but it pays off in terms of a Zen balance.
Yeah, exactly.
Straight.
Exactly. I always say if you don't develop those skills as a med student, like it starts in med school, like you start in med school, develop those skills, start to, have a social life, make that a prerogatory or something that you want to do. And then you'll continue that in residency. Because if you don't do it in residency, you're not going to do it when you're attending. Then you're just never going to do it. So you start now.
Absolutely. How about going into your residency interviews? That's kind of where I am now. How did you decide on this residency? What were the factors involved?
Oh man, it was a combination of things. First, it was a combination of, the interview day and, things that I looked at is the amount of autonomy I wanted. Did I want to be in the operating room a lot? Did I want to kind of be in a more just academic program? Did I want to mix the two? Number two, are the residents happy? Do they look like they get along? Because I've interviewed at some places where the residents didn't look like they got along. And so I thought, well, if they don't look like they get along and they look unhappy, then I probably will be unhappy in this residency.
Oh, yeah.
So that's
if they can put on a face for the interviewees and at least pretend to be happy for a day, that's probably a very bad sign.
And you also you can pay attention to how many residents actually show up to the interview day, because then it shows you how big of a priority the upcoming class of people are to that process. And it was just a fit for me, kind of where I was like, I feel like I could live here for 5 years. I know I didn't want to be in the country, not doing anything. I wanted to be in a big city too. So that played a part of it as well. So I think there's many different factors that can play a part in the program that you choose.
Yeah. So location is very important for me as well. And I guess for different people, they have different priorities, such as, I don't know, salary is not a huge deal for me. But there's such a spread. Like the Florida residencies seem to have salaries in like the 40s, as opposed to New York, it's closer to 70. It's like a crazy thing.
But the cost of living is crazy expensive in New York compared to Florida.
Yeah, and there's no income tax in Florida, so I guess it all equals out. I guess most of them are pretty congruent. How about, did you have student loans throughout medical school? You don't have to answer that.
Oh yeah, no, definitely. I have student loans. I have student loans. Still working on repaying them. Yeah, I have student loans. Yeah, I
Yeah,
was a
I mean,
part of the
I'd say
fortunate.
95% of us do, and it's crazy. It's a crazy thing. But
Yeah.
starting residency, how does that translate? I mean, I know some people are deferring their loans. There's income-driven repayment programs,
Mhm.
but living on such a small salary and working so much, how do you balance that? Are you paying back your loans now? Are you deferring? Are you on income-driven repayment?
So right now, what I did was I deferred them, but I'm still making payments on it, so the interest doesn't accumulate too much. That's what I'm doing right now. There are income based repayment plans and all that stuff. I'd suggest probably finding like a good financial advisor, that knows the ins and outs of the system, that can help you out. You realize this as soon as you become like an MD, like people will swoosh out of nowhere, and you'll have a lot of
Yeah.
people that want to be a financial advisor. But I think it's going with one that you feel comfortable with, and they can help advise you as far as loans and income-based repayment versus deferring, versus these forgiveness programs. There's a lot out there.
Yeah, I'm actually interviewing a financial advisor that specializes in student loans
Yeah.
in about a week. So I'm pretty excited for that one.
Oh, that's gonna be perfect, man. That'll be
Yeah,
a good
absolutely.
episode.
Yeah, hopefully it'll be good information for people like me out there who are in the upper tier of that student loan bubble.
Yeah.
So how about this? How about anything someone like me should be doing to prepare for intern year? Should I be having fun? Should I be studying? Should I be working? What do you think?
You should be
Stashing
having
money away?
as much fun as humanly possible. That's what I would say. You need to just go out
Yeah,
and just enjoy the time that you have now. Go travel, do a whole bunch, like knock off items off your bucket list. I wouldn't sit here and maybe you could do light reviewing before residency, like maybe like a week or two before it starts, just so you get brushed back up. But no, enjoy your time, man. Like have fun, go out and travel, do things that you want to do. Now's not the time to sit here and study in the books for weeks and weeks
yeah,
and weeks at a time. Now, have fun, man. Travel. That's what I did. That's what I'd recommend everybody do.
absolutely, man. It's going to be the next 3 to 8 years for some people. Some are
Exactly.
longer.
Exactly.
Yeah,
You're gonna be working this like you have a bunch of time. Well, not necessarily a bunch of time in residency to study, but there will be time in residency where you'll be studying, and you'll be like, man, I wish I would have went out and traveled to Colombia or Brazil or something.
yeah, absolutely. I'm going to China and Japan with my two best friends in a couple of months, and we're pumped for that one.
That's
But
gonna be
yeah, this is the
fun.
last chance that we're possibly going to get for the rest of our
Yeah.
lives, where we can take a month or two, take a real trip.
Yeah.
I'm
Like
with you. I
a
mean, I'm
real
not a
trip.
resident, but highly suggest everyone does this and
Yes.
start saving your student loans. I mean, everyone gets their check in the beginning of January and starts balling out, and by the end of it, it's like I can't afford the trip.
Nah.
Save,
Save it,
stash some
man.
money.
Save it up.
Yeah, absolutely. All right, so tell me your craziest story from residency so far, your intern year, or craziest experience.
Oh man, there have been so many experiences, man. Oh man, let's see. You know, working with trauma, orthopedics, and I do trauma rotation. You see many things. Like there was this patient where this girl was getting like she was trying to like stunt for the gram and get an Instagram picture right beside a plane with a propeller that was going, and stick her arm out, and arm got completely just wiped off by the propeller that was running.
Holy shit.
That's one that happened. It's being like trains that have ran over people. There's this lady that came in. This is when I was on a general surgery rotation. She came in. She was found to have like an acute abdomen. They went to the OR, and then the next day she ended up dying. Like you see a lot of different things, man, and you learn from each patient and each interaction with just like each case. You learn from it, man. There's so many. There are like countless stories I could come up with.
I'm gonna take you back to one. The girl's arm was chopped off by a helicopter blade.
No, not the helicopter. So those planes, like one of those smaller jets, but they have the propellers on either sides of the plane.
Uh-huh.
Like the metal propellers that'll go. So she
What?
was like leaning. You know how girls like will lean back to get a
Yeah,
nice
take the
picture,
picture.
and then just right down her arm. And I was like,
Oh
man,
man.
that's crazy. That sucks.
Was it sliced clean off, or was there some remnants? Was it dangling? Could you
I think it was
reattach it?
dangling. Dangling,
Oh
yeah.
man.
Yeah, man.
Yeah, that's like straight out of a movie, something like
Yeah.
that.
I've seen a lot of those.
if you got any pictures, I'd love to see. Maybe send them to me personally. We don't have to put it out
Yeah.
for the world, but
Yeah. I'll send you. I may have some pictures of that. I have a good amount of pictures of different cases. So yeah, man.
yeah, it's awesome. Do you have any closing thoughts, suggestions, tips for people going into intern year? Anything you want to share?
Man, enjoy fourth year. Enjoy it. Go out and travel. Have fun. This is like a period of your life you'll never get back. And you just have months, where you can do things. Do it. You're not going to get like 2 months off at a time in residency to go out and travel. Now's your time. Go out, have fun, make experiences, do new things, try new stuff. Just get out there and travel and have fun. That is my closing advice. If anything that you learned during listening to this IGTV or listening to this podcast, that is it. Do that during fourth year. Have fun.
I love that advice. Strongly suggested as well. And fourth year is an amazing time. It really is. You just got to make the most of it. Set yourself up for success over the next 3 to 5 years, and set yourself up for, get it all out of you right now. All the fun, vacations.
Mm-hmm.
Totally. Oh man, I'm nervous for next year, but thank you for easing my fears a little bit.
Of course.
Yeah, hopefully some people find this useful. And any medical students out there,
hey, get it. Hey,
med school survival kit, Dr. Cole. Thank you so much for joining us. This was a blast.
Man, thanks for having me on. Always a pleasure.
Always a pleasure.